the audience will depend on the business. But if we take a sort of life sciences or pharmaceutical company as an example, then you're going to have a certain level of engagement through various stakeholders. So you might be looking at the public as one, potential investors, funding bodies, even government, nice organisations, that kind of thing.
So we work with a lot of biotechs, and they're all fishing in the same investment space. So I guess the key audience for them is investors. And why should they put their money there? So what sets them apart, what differentiates them, and what impact are they going to have?
The main people who I speak to are potential investors. So that could be retail, could be private wealth managers, could be pension funds. So mainly professional investors, but all the way down to retail and media as well, I suppose, to some degree.
Our employees, without them, we have nothing. Our investors and potential investors are very important to us at the moment, and also those thought leaders in our industry, just making sure we're building those relationships with those people.
The other key client that we're working with is contract research organisations, and they want to sell their services and their products. So again, it's what differentiates your products, what stories are you telling, and can your clients help you to tell your stories for you?
The message that we're trying to communicate is one that healthcare is a place that people should be looking at with respect to investment, that there's lots of investment opportunities there, and also that change is happening, and obviously you need an expert specialist in order to invest successfully in that sector.
And certainly what we've seen in the last 10 years probably is a much more involvement of patients and patient-centric communications. So rather than perhaps patients being right at the end of the communication line, now they're at the centre, and charities and patient groups and advocacy and are getting much more involved, and that's really driven by the personalisation of medicine. So it's not a turn up at your doctor, get a pill, go away. It's much more involved than that these days.